Hi, my name is Vidit Bahri and I'm the co-founder of Sukoon Health, India's first chain of psychiatric and de-addiction hospitals. So after 1987, the Indian government released the Mental Health Care Act in 2017. The 2017 Act is actually one of the most progressive in the world, and it lays out very clearly the role of caregivers, professionals, institutes and patients in the ecosystem of mental health in India. So for patients, I think there's a lot of autonomy. Patients are now given responsibility to choose where they wish to get treated and by who they get to get treated. In terms of institutions, the Act clearly lists out minimum standards for infrastructure, professional care, and duration of stay. For caregivers, the Act now takes away a lot of rights, and something we faced in India a lot earlier. Caregivers won't be able to admit patients against their will in most cases. When it comes to insurers, I think something that the Indian Act lays out is mandatory for all private insurers to cover mental health under their insurances. This is something we've long been saying in the mental health space that needs to get activated, and we're very looking forward to this being activated for the patients and overall quality of care for patients. So I think that sums up the 2017 Mental Health Care Act. So I think firstly, the biggest challenge in India for mental health is a lack of professionals. The most recent study came out with that there are only 10,000 psychiatrists for a population of 1.3 billion. I would say the second challenge, and a prevalent challenge, is a cultural one, where in India it's still deemed as a taboo to talk about mental health and get help for it. So awareness, I think, is another challenge. A lack of prevalence of mental health institutes is another challenge that we face. Government institutes are working over capacity, and private institutes sometimes are out of reach for most people. So you talk about private institutions and lack of mental health establishments. I think another big challenge in mental health is the lack of insurance cover. This again cuts off a very vast majority of people from receiving quality mental health care, and adds to the taboo of the industry. So broadly, these are the four main challenges we face today. Availability of professionals starkly reduces, and also the treatment gap increases. So the challenge, I think, in the next 5 to 7 to 10 years really is, how do you make accessibility to care in tier 2 and tier 3 cities more prevalent? Where can technology come in play to make care by professionals more accessible? And how do you develop a model that an inpatient model that can serve people in tier 2 and tier 3 cities while maintaining good standards of care? So mental health in India currently is going through a revolution, right? There's a revolution happening on the online side, there's a revolution of mindsets, and there's a revolution happening for the inpatient side of things as well. I think the biggest opportunities currently in India for mental health is actually being able to explore the three categories of care: child and adolescent, adult, and geriatry. There are a lot of companies also foraying into the whole technology space and being able to solve mental health care at scale. These companies are literally giving you services in your house, on your laptop or mobile phone. So I think clearly addressing and doing preventive mental health care through tech can also be looked at as a huge opportunity area. And then where Sukoon sees itself playing a pivotal part is when it comes to inpatient adult psychiatric and de-addiction care. We feel that there's a huge gap in the market for quality mental health care when it comes to inpatient care when things get a bit serious. And that's the opportunity that we are most excited for in the short term. So at Sukoon, what differentiates us from others in the field is that we follow a very personalized approach to treatment. Each patient, each resident that comes into us, regardless of what service he comes in for, is assigned a multidisciplinary team. This team consists of a psychiatrist, a clinical psychologist, a counseling psychologist, a psychiatric social worker, a pharmacist, a head nurse, and an art-based therapist. These therapists and clinicians interact with the patient on a daily basis, not only on pharmacological aspects, but also psychosocial aspects, right? So the treatment is very personalized. It's not a one-size-fit-all model. And our philosophy revolves around the caregiver as well. We believe the caregiver's responsibility in continued treatment and continued results is very important. I think a big part of Sukoon service is also aftercare services post-discharge. So what makes us special at Sukoon is the personalized care model that we follow. Each patient is assigned a multidisciplinary team which consists of about 7 clinicians. These clinicians are psychiatrist, a clinical psychologist, an art-based therapist, a psychiatric social worker, a pharmacist, and a head nurse. The role of these individuals is to assess and optimize different parts of the patient's recovery. Another big feature at Sukoon is after discharge care, which we call continuity of treatment. This treatment is essential to see long-term results. Another thing at Sukoon we're very clear about is that you can't talk in absolutes when it comes to mental health, right? Once somebody is diagnosed with a serious mental health care diagnosis, it comes down to managing that care and managing it to the best of our abilities so that the intensity of that diagnosis doesn't surface again.